It's a real pleasure to be here today. And this afternoon, I'm going to briefly talk about some of the work that I've been involved with over the last 7 or 8 years, helping to develop, as the title suggests, quality standards to try and improve the provision of prevention practice and policy making in Europe. Of course, I'm here presenting today. I'm the figurehead of this project, but this is a project which has been undertaken across numerous European countries, also in collaboration with UNODC, with Giovanna in particular, and the European Monitoring Centre. And I must recognise the generous funding that we've received from the European Union. Really important to mention that. I want to start off with a provocative statement, at least from a European perspective. I really want to ask, do we actually have a problem with drug prevention in Europe? What is the current state of prevention with regards to the activities that we're delivering and the evidential basis of prevention? Now, I'm somebody who's very passionate about prevention. I dedicate my life to thinking about prevention. I work with prevention providers. I'm a board member of a prevention charity, for example. But I think we have real issues with the quality of drug prevention that we're delivering. And of course, as we've heard in the previous session, there's some interesting and useful evidence emerging about prevention. But if we actually have a look at what's being delivered, what young people, young adults are receiving, the majority of that prevention isn't evidence-based. The majority, I would argue, is probably ineffective. For policymakers, the people who hold the purse strings, are they getting good value for money? But maybe also from the perspective of young people, the recipients of prevention, what are we actually offering them? Is it actually ethical to offer our young people and those who are most at risk from the harms related to drug use ineffective programs, or programs which restrict their liberty, restrict their freedom, for example, restrict their behaviour, without offering them real health and social benefits? Really important ethical considerations. And I come from the generation when I was growing up in the 80s. Bill was talking about the just say no and this is your brain on drugs approach. This is the sort of drug prevention I received. Waste of time, as the evidence suggests. And I often fear that the provision of prevention hasn't developed substantially since then. Despite all the investment, despite all the good science, and despite all the good intentions of many decision makers and policy makers. Various estimates, but in Europe, for example, it's been estimated that on a conservative level, less than 10% of the drug prevention activity which is delivered could be in any way considered to be based on evidence or science. So I do think we have a problem with prevention, but I mentioned I'm an optimist. I think we're thinking and developing new strategies to improve this process, but it's not easy. Certainly not. And something that Pierre Arwidsson was talking about in the last session, that in order to effect real change, to bring about real benefits with regards to prevention and the provision of good prevention activities, is a long-term perspective. Pierre was talking about it takes decades, and it really does. In Europe, for example, we've been trying to move along the path of evidence-based prevention and prevention-based policies for at least 20 years. I've been involved in prevention for about 8 or 9 years, and I expect that for the rest of my career, I'll still be giving very similar talks and very similar pleas to that I'm giving today. So this is an activity which is going to take a long time. So if you actually have a look at European policies, right back in the mid-90s, we started to use phrases and activities around best practice to start to think about what were the most effective components, what were the most effective programs in order to support healthy development. In the early 2000s, coordinated by the European Monitoring Centre, began to initiate coordinated activities to promote and share good practice, a movement towards evidence-based approaches. And again, inspired by the European Monitoring Centre in Lisbon, started to develop guidelines and best practice guidelines, making recommendations about what were the most promising approaches. And please don't misunderstand me, I'm not trying to undermine this work. This is really important work, but I just really want to emphasize that we still have a lot more to do. But something which was really exciting for me and which has underpinned a lot of my work is actions and activities which have moved beyond the level of dedicated practitioners and academics to actually move to the political level to begin to energize policymakers and senior politicians to take evidence-based prevention seriously. So at the European Commission level, really interesting and important developments. And as some of you might know, very recently the Commission published a series of quality standards focusing on the professionalization of the workforce, the use of evidence-based programs, long-term developmental perspectives on drug use, which I think might invigorate many European member states to rethink about what they're actually delivering with regards to prevention. And indeed, in the EU Action Plan, there's some very specific actions which are recommending to member state governments to think about the quality of prevention work. We often think that perhaps at worst, prevention is a neutral activity, that maybe it doesn't really matter if it doesn't work. Well, the scientific evidence suggests, yes, that might be the case, but a lot of drug prevention activity can also have negative effects. If we're thinking about the ethics of intervention, if we're thinking about activities which change or attempting to change the behavior and cognitions of young people, then we need to take these issues just as seriously as we do medicine and psychological therapies. That's my view. Of course, the European Union is just one region which is undertaking work in this area. We've already heard about some of the really impressive work undertaken by the UN. In particular, in 2013, the publication of the International Standards on Drug Use Prevention. Now, I do hope audience members are familiar with this, but if not, this is perhaps one of the key documents that I would recommend to you. This is a really important document. This places prevention as part of a life course perspective. It doesn't focus on individual programs. It doesn't make recommendations about programs, but it talks about techniques which might be able to be generalized, transferred, or adapted to different territories. And this is a really important perspective, I think. In addition to the UN work, of course, we have the Organization of American States, who've been doing really important similar activities to try to support decision and policymakers around the provision and commissioning of high-quality prevention work. And I was really pleased earlier this year to also hear about the African Union action plans as well, to also initiate these sorts of activities, this striving for quality. Okay, so that's my introduction, but I want to spend a bit of time now specifically talking about some of the work that I've been involved in, the European Drug Prevention Quality Standards, or the EDPQS. So as I mentioned, I've been working as part of a consortium on this project since about 2008, and we have three very simple, although perhaps very challenging aims. And the first aim of this is to try and develop a set of criteria which will enable users, and I'll specify user groups in a moment, how to recognize high-quality prevention activities. So we've heard a lot this afternoon about evidence-based prevention, effective programs, but what the EDPQS try and do is to try and persuade you that effective programs are not enough. We need to be able to look at systems, structures, and foundations by which we deliver and develop those sorts of programs. So the EDPQS don't focus on content, it focuses on the environment and prevention context. Do we have the right sort of environment to subsequently deliver evidence-based prevention? And it also talks about activities and different tools to try and support the implementation of evidence-based prevention. A lot of the evidence that we do have around effective programs are limited to high-quality research trials, coordinated by academics, leading academics, of course, really nice trials and really nice programs. But the challenge for us is how do you upscale and how do you mainstream a lot of these activities? How do you ensure that all young people or all young adults are able to benefit from these effective programs? So the EDPQS guides us through that process as well. Central to the EDPQS is this notion of quality. And our definition of quality in the standards are not just focused on effectiveness. That's important. Effective programs are important, and the evidence around that is very important indeed. But we also suggest that quality in drug prevention extends to other considerations as well. So prevention needs to be relevant to target population needs. Prevention shouldn't be a set of activities imposed on our populations. We should be doing these sorts of prevention activities because our target populations are genuinely going to benefit from those actions, which is why prevention, in my opinion, shouldn't be focused on coercion or punishment. To me, that is not prevention. It needs to be ethical, and so issues around opportunity costs and unintended and negative consequences are really important. Good prevention is about collaboration with target groups. It's not, as I mentioned before, about imposing programs on target groups. I think also, I made reference and mentioned before about the evidence-based. Even in routine practice, prevention should be evidence-providing. All prevention projects should, whether that's through monitoring or different types of evaluation, should be providing evidence and disseminating success, but also disseminating failure as well. That's really important. What doesn't work, how we need to change things is really, really important. And the EDPQS emphasizes this. We also talk about feasibility and sustainability, but we do appreciate in today's economic climate, that's not always possible. But I'm thinking of David Foxcroft's earlier slide when he was talking about good behavior gain. The return on investment on prevention can take decades. Prevention activities need to be part of a long-term plan. So how EDPQS develops, I do appreciate this is a very complex diagram, but it's just to emphasize to you, and you can read more about this through the resources which I'll mention at the moment, that our quality standards are based on a logical framework. It's important to recognize that, and I'll be honest about this, we don't know whether use of EDPQS will lead to more effective practice, but I hope to persuade you that EDPQS are coherent, internally consistent, and based upon what we know about prevention systems, what might work. So what do the EDPQS actually look like? And we have a number of resources, and you can visit the website a bit later on. But essentially, we're asking you to think about prevention as part of this project cycle. And so we outline a number of key areas which we believe and our partners believe, and it's based on international consultation with hundreds of different sorts of professionals, that in order to successfully deliver and provide good frameworks for prevention, you need to pay attention to all of these really important considerations. I've already mentioned needs assessment, for example. If you want to deliver an intervention which is focusing on ecstasy use, for example, or amphetamine use, well, you need to make sure that the population that you're targeting at will actually benefit from those sorts of interventions. Needs assessment is key. Other sorts of things, some of the perhaps more pragmatic and practical things that those of us interested in scientific or academic questions don't particularly focus on. What sort of resources do we have available? What are the staff competencies? Who are the staff who are going to be delivering our prevention programs? Is the work that we're doing ethical? And I've mentioned some of those considerations before. How do we adhere to policy? Are we in concordance with national drug strategies, for example? So the EDPQS can be used in many different ways. I'm not going to mention any particular examples, but these are some of the ways that we have seen EDPQS used in Europe. For example, the planning of new prevention projects, the designing of new interventions that might be from scratch, new interventions, or the refinement of existing programs, perhaps some of those big evidence-based programs that we see in North America. We also strongly recommend the use of EDPQS to review and refine existing prevention activities. There's a number of tools and a number of activities which enable prevention providers and policymakers and funders to reflect on the sorts of activities that they're undertaking. And it asks a series of questions. How can you refine what you're doing? And we also think issues such as professional and organisational development are really important. In my view, for example, the field of prevention has been existing in the shadow of treatment services for many years, not only with the types of activities that we deliver, but also the professionalisation of our workforce. And hopefully EDPQS can help us achieve parity with our treatment colleagues. These are some of the examples, very briefly. In Sweden, for example, we've seen the development of national strategies, a national cannabis prevention campaign, partly based on EDPQS and the structures that EDPQS provide. In Poland and Croatia, funders have been making decisions about who to assign funding to, based upon adherence to our quality standards. In Turkey, and just this week in Morocco, and recently in Tajikistan, we've been running workshops and activities to help develop the workforce and to think about prevention in new ways. So EDPQS can be used in many different ways, some of which are mentioned here. Okay, so what resources are available? I'll just briefly mention some of these. We have a rather thick manual, which was published by the European Monitoring Centre of Drugs and Drugs Addiction a few years ago. It's a text-heavy, dense manual. It's not very user-friendly, but it essentially contains the core components and ingredients from which the rest of our toolkits and tools have emerged. In collaboration again with the EMCDDA, we've published quick guides, which is now available in several languages, mostly European languages, of course, but we're hoping to extend that. And all these materials are free. We've also recently, with the assistance of Commission funding, developed training and toolkits, which enables users to put that thick manual into practice, into practical activities. So we're focusing on decision makers, which include funders and policy makers, practitioners, the people who are actually delivering prevention work, as well as trainers and educators, those who've been tasked with improving the quality of the workforce, and different sorts of prevention coordinators, and I'm sure a few of the target audience are here with us today. So Toolkit 1 is for decision makers, focusing and supporting decision makers and helping them to select high quality drug prevention activities for financial support. And there's different tools and checklists which will enable you and support you to make decisions about what are good quality prevention activities that are deserving of funding. For practitioners, this is part of our professional competency development. So this focuses on those skills and those day-to-day routine activities and competencies that we hope that a prevention workforce has. Toolkit 3 for trainers. So this is almost from a train-the-trainer perspective. This is to enable dissemination of good practice and evidence-based approaches to prevention. And finally, perhaps some higher level toolkits for prevention coordinators. And this is for that target audience who's really interested at prevention at a systems level, or perhaps developing a new type of prevention system. So it talks about some of the necessary and important ingredients which might be included in a high quality prevention system. Okay, well, thanks for listening. So hopefully that's given you a very brief and broad overview of the work that we've been doing. I would encourage you, if you can, to visit our website where you can read more about the project, download these tools and toolkits, and of course, if you have any further questions, then don't hesitate to email me. Thank you very much.